Hi and welcome everyone to today's video. Today's topic is going to be based on peptic ulcer disease. Before I get started, I would just like to thank you guys for watching and for showing your support. And I hope you enjoyed today's video. So today's video is on peptic ulcer disease. We're going to be covering the causes, interventions, diagnosis, and treatment. So let's begin. So the causes are the erosion of the mucosal wall, which is basically the stomach lining that we have inside of the stomach. It is the lining that meets with the stomach acid. And erosion of the mucosal wall is just basically the breakdown of that stomach lining inside. One of the causes is the Helicobacter pylori, that it's also known as H. pylori. It is a bacteria that is in the GI tract, which is in the stomach or intestines. It can be detected by a breath test, and that could be done at a doctor's office or a lab. Another cause is an increased stomach acid. For example, for like people who have like heartburn or GERD or acid reflux, all of that increases stomach acid. Well, all of those are signs and symptoms of an increased stomach acid. So it's very important to know if you do have an increased stomach acid, because through time it's going to break down the mucosal wall of the stomach, and that would put you at a higher risk for a peptic ulcer. So the assessment for peptic ulcer would be abdominal pain, heartburn, melena, weight changes, and GI distress. So it's very important to know that when you are diagnosing a patient with a nursing diagnosis, the NANDA, that you need to see at least 2 or 3 symptoms of a category of a disease in order for it to be specific enough to say, okay, this patient has this or this patient has that. So I want to describe melena. Melena is just basically dark terry stools. They are also black. So if you notice black stools, that is very, very bad, and that is dangerous, and that's something that needs immediate attention. Because dark or black stools is just basically an indication that there is a bleed somewhere inside the GI tract. And if it is bleeding and constantly bleeding, the patient can bleed out if they do not catch it in time. Moving on. The diagnosis for a peptic ulcer is endoscopy. So the only way to know that you have a peptic ulcer is to look inside using a camera. They will go in through your mouth. They will insert a small camera and they will pass it through your esophagus, and it will go down into your stomach lining, and then the specialist will look and see if there is an ulcer that is seen in your stomach lining. The treatment for peptic ulcer disease is a triple therapy. It's two antibiotics and a PPI, a proton pump inhibitor. The two antibiotics are used to treat PUD caused by H. pylori. So the most common are clarithromycin and amoxicillin. They're used to treat along with the PPI. So the PPIs help to decrease stomach acid secretions, allowing the ulcers to heal. So that's very important, to let your stomach heal itself by helping reducing the stomach acid. So again, this is called a triple therapy for treatment for PUD. So the nursing interventions for this disease, like was mentioned in the previous slide, is a combination drug therapy with antibiotics and PPIs. Another one is a decreased acid secretions. by using H2 blockers and PPIs. Those are probably the ones that work best to decrease stomach acid. And another one is avoid NSAIDs, non-steroidal anti-inflammatory drugs. It's very important to, as a nurse, to educate your clients on the use of NSAIDs, because NSAIDs have a high risk of causing ulcers because of how harsh it is on the stomach lining. For example, one of these drugs is ibuprofen. If you are taking this drug on a routine basis for any other pain that you might be experiencing, if you take this on an empty stomach, you are causing harm to your stomach lining, and through time, it may cause a peptic ulcer, and you will experience another type of pain. So it's very important to take NSAIDs with food to protect, or to give it some protection from the medication. So another intervention is to educate clients on diet and lifestyle changes. This is very important. This is a modification that the clients have control over, such as eliminating caffeine, carbonated beverages such as sodas and stuff like that, foods that cause GI upset like spicy foods. And it's very important that if they are smokers or alcohol drinkers, that they stop and quit, because this is causing harm not only to other areas of their body but also to their stomach lining, and they might be unaware of it. So it's very important to educate. And then also to manage stress, because when you have a lot of stress, it has an increased stomach acid. So if you manage your stress, you might manage your stomach acid contents, and then that'll also help with your stomach healing. So that is it for today. Thank you for watching.